what do you think the skill sets gap, and because incentives drive behavior. So these days the GP consultations are fairly small and quick and like a machine.
A lot of people in the public think, oh, people who go into GP are just people who can't get into anything else. But in fact, the reality is that it is a highly specialised skill set to be a GP. And that really starts to erode trust. And that's a dangerous thing for a democracy.
Where would you put us on the spectrum?
From perfect to what we're seeing perhaps in the US at the moment.
Mm.
How much of that is coming to Forrest? None of it. So that's the real dilemma, because it's easier if you put that money into a big pool and you have a developer on the East Coast who, they're going to put it into Sydney because it's easy for them to make more money developing property in Sydney. So we had 10 years where Liberals were in government, and the immigration at that stage was around the 500, 600, 650,000 mark.
So how do you see the impact of migration impacting so how does that equation works? How do we move away from, kids in kindy or year ones giving doing that thing, going away from that nagging to more civil?
The more people you get in there who have come from different backgrounds, who have different ideas, who have different ways of interacting, and who are willing to stand up and say, no, this is not the way to behave.
What are the first 3 things on your table as you walk in the door of the Parliament you would be focusing on? Welcome, Dr. Sue. How are you?
I'm really well. Thank you very much.
Thank you for your time today, and it's a conversation I would love to have and understand your story and backdrop before we delve into the idea of politics and public policy from that space. Could you briefly give us your background and your story?
Yeah, so I grew up in Melbourne, and I'm the youngest of 4 kids, and I went to University of Melbourne to do my medical degree, and then I was doing some training in general surgery and decided to go overseas for a little bit, and then came back to regional Victoria and got into the urology program. So I then got transferred across to Perth. That's how I ended up in Perth. It's a national-based training program, and I came across to Perth quite some time ago now, and was fortunate enough at that point that the Nullarbor closed, apparently, and I couldn't go back. Joking. But the job that I wanted to go back to fell through, and the job that I started came up down in Bunbury. And my husband and I looked at each other and said, okay, let's see how we go. So we moved down to Bunbury, and I was the first urologist to set up a practice outside of metropolitan Perth. And I had a sole practice down in Bunbury at the new health campus that they were building at the time. I was heavily pregnant with my first child, and decided that setting up a medical practice and starting a whole new career would be a good time to do all of that at the same time. And then gradually over 25 years have been able to establish a really strong urology practice. By the time I was finishing up, we had 3 surgeons working there. We had a training urologist come down and work with us through the national program, which was really exciting to have a young urologist in the practice, and that had been going for about 10 years. And I had been an examiner for the College of Surgeons, and had done quite a lot of work in one of their sections of exams to modernise that. And I had done about 15 trips to Madagascar to do aid work.
Lovely.
And so I was kind of looking for the next big challenge. And for a while I had been interested in our political system. And I had heard an interview with Helen Haynes, who is the independent member for Indi in northeastern Victoria. And the way that she described what she was able to achieve in Indi really resonated with me for a regional electorate. And so I started to do a whole lot of research into what had happened in Indi and how they had established a community independent. And then we had the 2022 election. And at that election, there was a big swing against Liberal in Forrest. Now, Forrest is a very staunch Liberal stronghold. It's been Liberal for only 52 years. And so there was a big swing against Liberal at that election, and there was the success of the community independence across Australia. And so we started really becoming active in a group called Voices for Forrest. And for 15 months, we did a kind of community consultation project. And during that, we would go around, we would have kitchen table conversations with people, we would invite people to fill in surveys, we would go to markets and get people to fill in surveys. And at the end of that, it was apparent that over 85% of people in Forrest didn't feel well represented. So it was a decision then that the committee said, well, are we going to look for a candidate? And at that point I said, I might just walk away from this process for a period of time to really consider whether that was something that I wanted to do. I had also been involved in an environmental protest in the southwest, and that had made me realise just how broken our electoral laws are, and also how easy it is for community groups to get shut out. Our local member wouldn't even meet with us.
Before I delve into these specifics, and there's so many things I could go there, but I want to start from, there are a few things you have done across multiple roles, whether you start your business and whether you were educated and then you're traveling to Madagascar for aid work. If you can tell me what was your purpose and how have you evolved? How has that evolved in your life, and what do you think now, looking at your life from being a young girl to today? How has your purpose evolved, and what it is?
In my family, there was always a very strong sense that it's so important to give back. And so for me, I consider myself to have been incredibly privileged. I've been well educated, I've had a stable family, I've had opportunities put in front of me. And it's always that sense that you have to give back. If you've been given such enormous reward, there's a responsibility to do good in some other way for some other people.
And how has that reflected in you doing the work you have done, and how has that matured the sense of giving back?
Yeah, I think it's always been there, but it kind of...
Or crystallized?
Yeah. I think what ended up coming out, people would always say to me, oh, you're so good to go to Madagascar and do that aid work. And in fact, for me, I would feel consistently that I would get more out of it, because I was helping to train other people. I was building resilience in a system. I was helping people who may not have been able to get that assistance. And I think that's part of everything that I've tried to do. It's about trying to make my little patch of the world better, whatever better might be, as well as helping bring other people along on that journey and make things better generally. So by training the next generation of urologists, that's a really important thing that people need to do. If you've been given the training by others, I always say I stand on the shoulders of the people who have helped lift me up.
You have worked in a couple of health settings. What's your view on broader, the role of the state government in playing critical role in providing good healthcare for people of the state, and overlaying with the complexity of funding between state and the federal, that what role does the federal government play from your point of view, and what are the bigger policy challenges we are facing?
I think in health, it's always this dilemma. The state government tends to focus quite heavily on bricks and mortar. And, you know, here's the shiny new ward, here's the big new hospital, here's the redevelopment. And what gets lost in that mix is who's actually going to staff it, how are you going to bring those staff into that area, and how are you going to retain those staff? And what's the culture in the hospital that you create that makes it a great place for people to want to come and work? At a federal level, you know, the federal government will put support into Medicare. And on paper, that's great. They've recently announced billions of dollars to go towards Medicare. But what that fails to recognise is that the subsidies are all towards really short consultations. They haven't adequately subsidised the longer consultations, the healthcare plans, the mental health care plans. And so primary preventative care misses out all the time. And good quality primary preventative care is not prioritised in our country. And for me, I've always been at that really pointy end. You know, I've been a surgeon.
Yes,
I've been working in a tertiary centre. But you can see that there's so much that could be done outside of the hospital system that would ultimately prevent people ending up in hospital.
Yeah.
But we don't prioritise that.
No. There are three, as in from a health sector point of view, the nursing fraternity, the GPs, and the specialists. That's the probable rough hierarchy in that structure or health interaction of people who are living here. In terms of what do you think the skill sets gap, and you know, because incentives drive behavior. So these days the GP consultations are fairly small and quick and like a machine. And then what are the incentives, or what I think that there are wrong incentives somewhere there, because a GP consultation should not be that short. And then, you know, what are you here for? Then give me your name and all of that information, plug it and give you a prescription, and then there you go. So what's the, first of all, my bigger question is there a skill set difference between the nursing capacity or capability with GPs? One is that. And can that, if there is no difference, can that work be moved to nurses? Or if there is a bit more add-on value add, why can't GPs be upgraded with specialist services or specialist curriculum to doing specialist work?
Okay. Very different streams, I would say, of education and workplace philosophy. If we start from a GP, you know, everybody who does medical practice or medical studies, GP is now a specialist component of medical studies. Now, a lot of people in the public think, oh, people who go into GP are just people who can't get into anything else. But in fact, the reality is that it is a highly specialised skill set to be a GP. And the difficulty I have is that the funding incentives that are put into Medicare do not recognise that incredible skill set that those GPs have trained with and for, and they devalue that skill set enormously. And if you talk to many GPs, they're not satisfied with the 6-minute consultation. But if they're working in a corporatised setting, that's what they're told they have to do. It's not providing good health care. They would be much happier and much more comfortable doing the full 45-minute consultation or the 30-minute consultation or whatever the patient needs for their consultation. That would be a much more satisfying model of care for the GPs, because that's what they've been trained to do. But they're not incentivised financially to do that. So for me, that's where we have to flip our thinking about GPs. They're incredible, and they are on the front line every single day. They don't know whether the person who's walking in the door is simply there because they want, they've got a blocked nose and they don't know what to do, or whether in fact that person has a blocked nose because they've got a brain tumour. It's an incredibly difficult job. And I have an enormous amount of respect for GPs. I think their training needs to be really improved in terms of advocacy for GP practices and advocacy for GP training. But then you've got to back-end that by saying, here's a really fulfilling role for you to play in the healthcare system in the longer term. Specialist training, you need to spend now, it's a minimum of 4 to 5 years on top of your medical degree, on top of 3 or 4 years in the hospital system to become a specialist. And to have that capacity to call yourself a specialist, you do need that apprenticeship period of time where you are seeing an enormous variety of illness, you're dealing with an enormous variety of operations, so that you can in fact have the skill set that you need to be that specialist.
If you compare healthcare services across Australia with OECD's countries, in terms of how do you think the delivery of the idea of a good healthcare for every Australian at the same quality wherever they might be, which postcode, how do you see the gap today?
Well, we didn't get onto nursing, and I think there's a real, nursing is so broad. If you look at what nurses do, you can be a nurse practitioner, which means you can work in a remote community and you can have prescribing rights and you can order investigations and you can liaise then with doctors in a metro centre and provide extraordinary healthcare to those regional environments. There are quite a lot of restrictions around how nurse practitioners work. And I saw recently that there's been some push to expand their capacity and to promote training for nurse practitioners so that people in remote areas can in fact get access to good quality healthcare. And those nurses will be supported by a medical practice or by a GP practice, but they also have a very significant skill set that really would assist their community. There's a group of nurses who work within GP practices and who, again, do an extraordinary amount of work just helping the GPs, giving vaccinations, doing dressings, helping assist at minor procedures. And that's a whole skill set that we need to encourage. And then you have hospital nurses, and then you have all the specialist nurses. So it's very hard to talk about nursing as a unified concept, because now it's so diverse as to what they do.
You chose to run for the seat of Forrest, and typically people who are living in the local areas do not understand the idea what Forrest is, because people know their own suburbs, which area do they live. So do you want to define the geography of the seat of Forrest, and what do you see the tapestry of the variation of the geography and demographics, if you can?
Yeah, so Forrest runs from Yarloop at the northern border, which is close to Harvey. Many people would know Harvey. And then it comes down along the coastal strip through Australind and Bunbury. And then it goes a little bit inland to Boyanup and then down south through Capel, through Bustleton, into Margaret River and down to Augusta, and just a little bit inland of Augusta is a place called Scott River. So it's quite this long stretch along the coastline. It encompasses 6 different local government areas. And traditionally people thought that it was rural in the north and urban in the middle and greeny in the south. But there's been a huge demographic change in the last 5 to 10 years. We now see that there's people moving into Harvey and moving into Brunswick Junction because they can afford to buy a house there. And there's significant urbanisation in the northern part of Bunbury, significant urbanisation around Busselton and around Cowarama. And even Margaret River is developing some pretty urbanised areas. So there's been a really big change in the demographics.
As you said, through Voices of Forrest, you were doing a long-form community consultations across 18 months period. Could you talk about what were the top challenges and conversations you were having or issues people were talking about?
Yeah, out of that report came pretty much 4 big issues, and then towards the end a 5th one started coming in, which you might expect. So they were regional housing. It's a massive problem in Forrest because we see a significant increased number of people who are becoming homeless, as well as people who are being completely priced out of both the rental and the ownership market. So regional housing, regional healthcare, the real difficulty of how we protect that beautiful environment which everybody wants to come down south to see in the face of such significant population pressure. And that protection of a biodiversity hotspot is really critical to a lot of people in the community. And then integrity in government kept coming through, that people felt really disappointed in how they were being represented. They felt that a lot of politicians were simply there to get their next big corporate job, that there was a lot of backroom lobbying, a lot of stuff that was going on that the average Australian had no access to, but was influencing major decisions. And so a lot of feeling that we had lost something in our integrity in politics. And then towards the end it was cost of living.
How do you define, on a spectrum of democracy, on one end being dysfunctioning democracy and on one end being a functioning democracy, what are the key indicators? What are the telltale signs? How would you define a democracy is functioning and how would you define democracy is dysfunctioning?
Look,
And where we are right now.
Yeah, I think that for a democracy to function well, people should or need to be engaged, and they need to actually care who's representing them. They need to want to be part of that process of having a representative who looks after their area. On a bigger scale, it's a respect for institutions in a way, and it's a respect for the fact that having a government that has been elected by Australia to make decisions on our part, people should want to feel proud of that. But unfortunately there's a lot of people now who, for whatever reason, they don't feel engaged with their local representative. They don't feel that they have any say. They don't feel like they're listened to at any point. And they see a level of corruption which bothers them. And that corruption then means they start to question the integrity of, major scientific bodies like the CSIRO. And then you have our leaders who come out and question the integrity of our major scientific bodies. And that really starts to erode trust. And that's a dangerous thing for a democracy.
And where would you put us on the spectrum?
From perfect to what we're seeing perhaps in the US at the moment. I think the community independent model has in fact brought us closer this way.
Towards perfect.
Well, to better.
Leaning towards perfect.
Better. I'm never going to say perfect, because what is perfect? But I think that more people are engaging, more people are interested, more people are actually putting their hand up and saying, hang on, something's wrong here. We need something to change. And for me, the community independent model brings back that sense of engagement, of people genuinely wanting to be part of their democracy.
Because as the community independent model has, it triggered and created a lot of conversations across the country, and then I think more than now 40 people standing across the country as independents. How do you see that changing the dynamics in the parliament? Because there is Liberal Party, the Labour Party, the Nationals, the Greens, and there are many smaller parties. And what role would they play, in your understanding, in terms of when they are, quite a few?
I heard Zoe Daniel describe the independents as the potential backbone for the country, because it's often with the two major parties. When they're in office, they say this, and when they're in opposition, they say this. And, they flip, and they end up saying exactly the same thing when they're in power, and then they disagree when they're not in power, and it becomes a really same for the majors. People are now saying, there's not a lot of difference between the two. Whereas for the community independents in the middle, there can be this stabilising process where, this group of people in the middle can actually be saying, we're a consistent force that are trying to push change for the betterment of Australia, for the betterment of our constituents, for the betterment of everyone. From a crossbench point of view, I think that the last time we had a minority government with an expanded crossbench was one of the most effective times when we saw legislation being passed. And in the last parliament sitting, there's been a government report, and in fact it's been shown that the increase in the crossbench has improved the quality of debate in Parliament, it's improved question time, and it's improved the interrogation of legislation with an increased number of amendments. And all of those things come about by having people in the Parliament who aren't tied to a party line. They're tied to looking at what's best for Australia, their constituents, and what's the evidence to make that decision.
The top thing you talked about from the research with community was regional housing. And again, with housing, it's also state and in federal play.
Yeah.
So can you talk about your views of the current regional housing policy, whether it's state or federal, both?
Is there one? The short answer is there isn't one. So when we look at housing policy, most times what happens is that the government will announce, the next housing future fund. And here's the amount of funding that we're going to put out this financial year or this budget. And from a regional point of view, I say, how much of that's going to the regions? None of it is quarantined for the regions. How much of that is coming to Forrest? None of it. So that's the real dilemma, because it's easier if you put that money into a big pool and you have a developer on the East Coast who, they're going to put it into Sydney because it's easy for them to make more money developing property in Sydney than it is if they go and develop in Orange. Same in Western Australia, it'll be all Perth-centric based with minimal investment in the regions. So you need to actually have regional representation to say, hang on a minute, don't forget us. If you're allocating money, regional Australia has one of the biggest growths in population. And so why aren't we getting an allocation of money for housing directly for us?
What do you see the value of, when you talk about housing, you should also talk about homelessness into one breath. And a homelessness strategy or a housing strategy should cater to the challenge of homelessness. How do you see that these two conversations being had at the same time rather than a random numbers on dollar value?
I think that any decision around housing also needs to look at where are the demographics, who are we trying to help, and how can we help them the best. And so homelessness is, providing accommodation, providing the capacity for someone to have a roof over their head. Mm-hmm. That's a vastly different thing from home ownership for a young couple. So I think that you do need to have targeted strategies for each of the demographics that you're looking at. But in general, what we should be encouraging is if we're going to build housing, we need to be building a diversified housing stock. We've got to stop building the 4x2 with movie rooms. That's a big feature in the Southwest, and we really need to diversify the types of housing that we have. We need to diversify how we build our houses, because again, in the Southwest, if you want to build a standard house, it's 2 years minimum. Whereas we could be building modular homes in a 12-week time frame. Mm-hmm. You have to look at how we make housing accessible and affordable. Mm-hmm. And so you may then need to tie in that some of that housing is either rent capped, so that people who don't want to own or who actually can't own, mm-hmm. but they have a secure, safe, stable home that they can call their own. Mm-hmm. So we have to diversify our housing stock and our model of who owns housing, how we manage that housing, and who is actually getting into that housing model. Mm-hmm. And at the moment, we're building a one-size-fits-all.
The idea of housing affordability would require some kind of economic reforms at a macro level, because for an average person to buy an average home, or average family to buy an average home, mom and dad both have to work. But people should have the choice to, have a single parent household or one parent working and one parent taking care of the kids. So they should have the option, at least, if they don't want to. But that's purely their call, but they should have an option. But now it's, in a way, it looks like as if an average family, both mom and dad have to work to put food on the table, pay for the mortgage. So the idea of housing affordability, for me, I think if you can buy and live an average life in a single income household, that's the idea of housing affordability probably, and what kind of economic reforms could produce that kind of outcome for average Australians?
I think there's two answers to that question. The first is to ask yourself the question, how many houses are empty at any moment in time in WA? Mm-hmm. And look at reforming that market.
Investment properties. Yeah.
Sometimes it's an investment property, sometimes it's a holiday home, sometimes it's on the short-term rental market. Mm-hmm. And sometimes it's a house that's purposefully left vacant because somebody is trying to realise capital gains. So I think we need to look at how we bring those houses and those places back into the marketplace. That would allow us to open up an enormous amount of housing very rapidly. The bigger picture that I know you're referring to is taxation reform. Mm-hmm. Or I assume that's what you're leading towards, is taxation reform. And we have had multiple reports over the years. Henry Report, the Australia Institute, talking about the fact that our capital gains tax discount is what has significantly contributed to our housing unaffordability. And we need to be looking at how we phase out that capital gains discount, probably over a 5-year time frame. Negative gearing is what lots of people talk about, but the impact of negative gearing is probably far less than the impact of the capital gains tax discount. But we need negative gearing reform as well, so that we can say to people, yeah, sure, maybe you have one investment property if you're fortunate enough to have the capacity to have one investment property, but stop the capacity to have 2, 3, 4, 5, 6, 7, 8 investment properties that you can negatively gear. That would seem inappropriate.
Mm-hmm. When almost always when we talk about housing affordability and housing availability, one leads the conversation to migration. So how do you see the impact of migration impacting so how does that equation works? Migration and housing affordability or availability?
Recently I read a statistic that the impact of migration is probably only 1 to 2% on our housing affordability. So it is important to recognise that there has been a spike in immigration post-COVID, and a significant number of that has been students coming in to study in our universities. I think it's not unreasonable to say we should have an immigration policy which accurately maps out how many people can come in, how many humanitarian refugees we're going to take, and how we're actually going to house and look after those people when they come. And interestingly, Australia has never had an immigration policy until last year, after the repeal of the White Australia policy. So we had 10 years where Liberals were in government, and the immigration at that stage was around the 500, 600, 650,000 mark. Then, of course, it went down during COVID, and now we've had a bounce over the 700,000 post-COVID. And, you know, presumably that will stabilise out again. I know the major parties are talking about limiting foreign investment in homes, and that's certainly something that could be looked at. But we also need to recognise that Australia is built on immigration. We need people to be coming to this country because we don't have enough skilled workers in a large number of our areas of need. So we have to be sensible that those people who are coming into our country and we are welcoming them into our country, well, they have to have a house over their head. So why should they not be allowed to own a house?
Mm-hmm. The idea of being a sovereign country and and being able to defend yourself should be of very importance. How do you see Australia being a sovereign on its own in real terms, and how do you define sovereignty and the idea of what needs to be done if we are not?
I think sovereignty needs to be considered in terms of a number of different aspects. You know, a lot of people use it in terms of defence, but I think we need to be very sure about our manufacturing and what are our critical needs for this country. And COVID definitely exposed that we do not have sufficient manufacturing, particularly in medical areas, with significant medicine shortages and significant shortages of IV fluids. Mm-hmm. So we need to have a discussion about what are the critical things that our country needs as part of our manufacturing base. Part of sovereignty should also be discussing how we're going to feed our country, mm-hmm. and making sure that we are protecting farmland and protecting farmers and making sure that we can feed our own people. Defence, well, that becomes really tricky because we're a big island in a big ocean. And traditionally we've had allies like the US and the UK. And you know, one would now have to look at what is happening in the US and question whether they are friends still and really allies, or whether we need to be revisiting where our international relationships might be. How we protect our sovereignty, that's tricky when you've got a small population on a big island in the middle of nowhere. And I think, for me, I would like to see a much broader discussion around what does our defence look like? And mm-hmm. is it sensible to be focusing on military hardware? Why aren't we looking at innovative things like, let's be a little controversial and say, why aren't we training kids to hack? Mm-hmm. Because we're having hacking attempts coming in on us all the time. Yeah. And if you could have a significant cyber security and cyber warfare mm-hmm. department, may that not be more effective mm-hmm. than pouring billions of dollars into nuclear submarines? Mm-hmm.
It's been a challenge for the defence to, you know, acquire more workforce, and what do you see that is effective of? You know, is that the idea of the national identity, you know, of the past, or trying to serve your country, and then are we not able to attract more people to the defence services? What do you think is a challenge there?
I think,
because I saw an ad by a South Australian police commissioner. He ran, you know, I saw an ad for them to hire police officers from other countries and then give them immigration pathways. But again, for these critical core services like defense and police, can we outsource?
Excuse me, I think for defence, it's always really difficult when you have a community who has grown up with peace, convincing people to go into defence, because it's never been relevant in their lifetime. And then they see foreign wars where people are being killed and huge numbers of both civilians and soldiers are being killed. And if I was a young person, I would have a lot of questions about going into the military, because I don't want to be on the front line in that circumstance if Australia ever went to war. So I think defence, trying to recruit into defence, one of the most successful ways that they recruit is by offering people a pathway to a career. And that's a really positive way of getting people to come into a defence force. So you offer them training, you offer them education, you pay for their university, you pay for their TAFE degree, and then for a period of time they will work in the Defence Department. And what you hope is to promote a culture within that Defence Department that then they want to stay. But that's quite complex. And a lot of people, now are quite, I would say the culture has changed, where if you look at what was happening in the First and Second World Wars, it was all for king and country or queen and country, and people accepted that there would be officers and the officers would tell them what to do. But again, there's that lack of trust in that system now, because they've seen it being abused. And they've seen, people going off to military college and then coming out having had issues with sexual harassment. And I think that's a real dilemma for the culture within defence. That, you're not going to recruit people and retain people until you improve your culture.
And then on the idea of sovereignty, you talked about multiple things. You see, are we able to produce enough medicine for our people, produce enough food? But are we also able to produce enough energy sustainability, or for all of them, all of our people, we should not have blackouts, because that would create, inefficient so much. And so I could not believe we might go to a blackout sometime. But how do you see energy sustainability, or a positive energy economy to be created?
I think, again, it's important to look at it in terms of sectors. So if you look at the domestic sector, it would be quite easy to democratise that with subsidies for rooftop solar and subsidies for batteries. And then people can, in fact, take responsibility for their own energy production and usage, and that allows a lot of tension and stress to come out of that individual situation. So instead of offering a short-term electricity rebate, let's start to talk sensibly about electrifying your home and actually powering and supporting your own home. And if you have the capacity to buy an electric vehicle, well, why shouldn't you be able to plug that electric vehicle into your grid so you can power your own home? And the technology is there, but our government hasn't enforced that with the EV manufacturers. So domestic, relatively simple solution, I think, with renewables and batteries. If you look at manufacturing, then the middle ground of manufacturing, which is food manufacturing, small factories, small capacity manufacturing, that can be electrified relatively easily. And so then you have the capacity to say, well, let's support those companies to electrify, and that allows them to democratise their process. The big problem is when you get into the big industrial users. And in the southwest, we have a couple of those. And, there's no sensible way that at the present time we can run those big factories 24/7 on renewables. And that's just the fact of it. So I think we have to look at how we do have a gas reserve, and we're lucky enough in Western Australia to have a gas reserve. But we need a time frame where we have that gas reserve that is supplying those big industries while we support technological intervention and other alternatives to actually work out how we can improve them in the long term. The big mining companies, they're already electrifying everything because they see the value in doing that. So I think it is possible to have a renewable future. I think it's possible to have, a great system, but unfortunately for a period of time we are going to need to have gas most likely as our alternative fuel source for the big industrial users.
Science is science. Science is factual based, as you said. It's factual. You can't run on renewables permanently. You have to have alternate source, and science does not require emotions. It requires facts and figures. And how do you see the energy mix on a scientific idea, not emotive idea that this is good and this I want to wage a war on this kind of energy solution? So how do you see energy mix being used, and how can we produce most effective energy mix to produce the lowest cost or the optimal cost energy for everybody?
I think the whole energy argument tends to end up in this, I'm in this camp or I'm in this camp. And for me, I want to try and bring together multiple different ideas. And so that's what I'm saying, why aren't we, when people buy an electric vehicle, why aren't we using that as a battery bank? It's the biggest battery you'll ever buy if you have the capacity to buy an electric vehicle. And if governments bought electric vehicles, and then they were stored overnight and plugged back into the grid, well, there's a massive battery bank just sitting there, ready to go. So in the big picture of things, I think we have to have renewables because Australia has an enormous capacity. We have space and enormous area where we can put sun and wind, solar and wind technology. We then have to recognise that we are going to have battery technology of some sort, and whether that's lithium-based batteries or there's newer versions of batteries, or you go to Morocco and you see the molten salt battery, and you just go, wow, that's an incredible concept. So we need to look around the world to see what other people are doing, and then, we have massive gas reserves, and at the moment we're selling it for nothing. So why aren't we using our own gas in our own systems to support our networks until we work out, can we do green hydrogen? Can we do biodiesel? Can we do some other form of energy for the big energy needs?
If you compare from an education point of view, the education standards or the outcomes on literacy and numeracy, if you compare ourselves with OECD countries, are being, not leading but lagging. How do you see that trend in terms of education system being not creating? Because a good education system is a leading indicator of good economy in the future, good workforce in the future, and then good leaders as well. So how do you see that problem or a challenge for the future?
Education, I think, is one of those really, again, massive issues that we have seen a marked decline in numbers of people who want to go into teaching, and we've seen a marked decline in number of people who stay in teaching. Whereas other countries where education has perhaps a different pathway into teaching and a different value system around education, they encourage teachers to be highly qualified, and then those teachers are given a degree of autonomy in how they actually manage their class. We've attempted to have a standardised system across Australia, and we know that one size doesn't fit all for kids. We've underfunded that system for years, and we are now playing catch up, trying to fund that state system. And so, not surprisingly, we're seeing poor education outcomes and poor teacher satisfaction. So thankfully, we've now got a recognition that state schools do need much better funding. And hopefully if we start to fund them more appropriately and we start to actually give teachers the support that they need and we actually start to look at, is there room for individualisation in a school or in a state or in an area? Because what works in Alice Springs may not work in Sydney in terms of how you're trying to teach these kids. And yet we attempt to standardise it with these ridiculous NAPLAN tests that really all they do is set some kids up to fail and other kids get told to stay home on the day that NAPLAN testing's happening so the school can keep their results and keep their funding. So, you know, I think we need a real discussion around education and we need to really try and boost our education system. But also with university, you know, the HECS debt for our students is crazy. And we need to really go back to thinking about, can we introduce a much fairer system and can we go back to saying, do we have the capacity for free education at university for your first degree? Because that would go a long way to improving our capacity for learning, for our appreciation of learning for its own sake. I mean, I'm sitting here in a group of, you know, in amongst a whole lot of beautiful encyclopedias, and that's learning for learning's sake. But again, we have kind of put education through this profit-based system in the universities. And we've lost that art of thinking that education and learning is important of its own.
Going back to the Parliament, you know, you said, you know, you saw a positive outcome because of independence. There's a change of, you know, the conversations you're having. But how do you bring about the change of decibel level, reducing it down a bit when the idea of throwing, you know, slurs and language, how do you make it more civil or how do you make it, the time should be spent more towards, let's come together and solve the problem rather than, you know, pointing fingers and then being as noisy as I can be or finding a good new terms which are being used and then throwing on the other side. And then who can be the best? And there is no winning war in that. Nobody wins. How do we move away from, you know, kids in kindy or year ones giving doing that thing, going away from that nagging to more civil conversations?
Have a wider group of people representing the country. Have people who come from other workplaces where that behaviour is completely unacceptable and who actually have the capacity and the courage to stand up and say, this is my workplace, this is unacceptable. But also acknowledging that Parliament is essentially a place where ideas are meant to be discussed, but having the tone of that discussion, you know, the more people you get in there who have come from different backgrounds, who have different ideas, who have different ways of interacting, and who are willing to stand up and say, no, this is not the way to behave. That's how you get change. It's not going to happen overnight, because I can tell you, I've been a surgeon for 30 years. And when I went into surgery, surgeons were primarily men in blue suits who behaved badly. That's changed. As more and more people have come into the system and who have stood up and said, no, this is not the way to behave, you gradually get change. And that's what I would hope to see in Parliament.
On the agriculture side of the policy, in terms of sustaining, you know, there is a conversation on keep the sheep because that's very localized issue and a challenge for West Australians because the majority of the sheep has been exported from WA. So how do you see that? Because that's the core agricultural activity that supports a lot of families who are in that sector, plus truckies, and there's so many associated sectors or families and people who are in those regions. So how do you see that supporting an agrarian economy to produce food for us and then create, you know, the wealth and prosperity in the regions?
I think that I've spoken with quite a number of farmers over the last few months, And there is this real dilemma with farming families because they genuinely feel that they aren't being heard, they aren't being supported, and they're not getting a fair price for their produce. So that's farming in general. If you talk about the keep the sheep argument, then really what we're talking about there is, as you say, a very West Australian problem and a ban that has been put in place to start in 2028. And that has been legislated. So, it's not as if it's going to change if Labor gets re-elected. From my point of view, within the electorate of Forrest, we have few sheep farmers, although we have people who are associated with sheep farming families. But we actually have 3 big processing facilities, and we have the Busselton Airport. So where I've landed on the sheep discussion is to say that the time frame that the Labor government has put on the end is unjust for farmers. It doesn't allow for transition. It doesn't allow for us to build the rest of the systems that need to be in place to keep those farmers having an alternative source for their, getting rid of their sheep. So, for example, in Forrest, there's one abattoir that would really like to expand and has the capacity to expand and has the plans available and on the table. They say they have the workforce, they say they have the offtake capacity for the produce. That's a 5-year project to even get that off the ground. So for the farmers who need an alternative pathway for their sheep, the current time frame is just completely wrong and it's unfair and unjust. So if I was elected, I would be aiming to put an amendment to that legislation to say we need to delay that end to the live sheep trade. Now people will then say, well, that still means you're pro the live sheep trade or against the live sheep trade. And in fact, what I'm saying is we need to build capacity and resilience within Australia to manage our own resources. It's much better to value add within Australia. And if we were to upgrade the Busselton Airport, we would then be able to have international freight up into Indonesia, up into India, and hopefully ultimately over to the US if we lose the tariffs. And even if the live sheep trade continues, you have to look at where those ships are going, and they are going through a very troubled part of the world at this point in time. And ships have had to be turned back because there's been armed attempts at, sinking them. So even if the live sheep trade continues, with the world in flux as it is at the moment, we need to be building local capacity and local resilience so that our farmers have alternative ways of offloading their sheep.
To create more wealth and prosperity for the country, we would need a bit more stronger economic reforms rather than, throwing away expenditure from the budget. What do you see are the economic ideas would change, the next 10 years?
Well, I think the biggest issue in the budget is where are we getting our money from? Because at the moment, taxpayers are really carrying that burden of where the government gets their money from. So taxation reform would probably be the single biggest way that we could improve our economic outlook and have more money for more things like education, health. At the moment, multinationals are in this country and not paying tax. They're exporting our resources and not paying tax and not paying us a reasonable price for those resources. So we need to look at where our balance of our money coming in to our budget is actually coming from and make big reforms there. And then we would be able to make other reforms.
My concluding question for you is, what are the first 3 things on your table as you walk in the door of the Parliament you would be focusing on?
Well, in that scenario, it really depends what the legislation is that's being put forward by whoever ultimately becomes the governing or the government of the day. But what I would like to see on the table taxation reform, reform of the EPBC Act, and actual reform of our Medicare so that we get more money into primary healthcare.
Thank you.
Thank you.
Thanks a lot.
No, that's absolutely fine. Thanks.